In vitro fertilization isn't for everybody. The average cost is about $10,000 for one cycle. In vitro fertilization using eggs donated from a younger woman costs close to $15,000 each try. So this gets to be expensive.
Well, I think the first comment is that in vitro fertilization in the right setting works. I think that's the first point I'd like to make. Nothing is more successful in helping women have babies. Even a natural conception isn't as easy to conceive as with in vitro fertilization.
It isn't?
It is not. In good settings, a woman under the age of 40 where there's no male factor, male infertility involved, in good programs can expect upwards of a 35 and as close as to possible as a 40% chance of getting pregnant every month. And the chances in nature is only 20% per month.
Could you explain this to all of us, meaning myself included? When I say that, I put everybody else in. Like when it's in vitro, you take the egg out, and then the sperm is already someplace, and you're ready to go bingo right away?
Well, the woman is given fertility drugs to make her produce a number of eggs in little fluid-filled spaces called follicles.
Right.
Then at the right time, a needle is inserted into the ovaries. Under local anesthetic or sedation, the eggs are aspirated, removed, in a 10 to 20-minute procedure.
Right.
The woman goes out, and then those eggs get fertilized, and 2 days later they get put in her uterus, or as you've heard, in somebody else's uterus.
Okay.
Or fallopian tubes even, so they can travel to you.
The question is, I'm just trying to get exact step by step. The eggs are aspirated, they're out. So now where are they? Sitting in a cup someplace?
They're in a petri dish in an incubator, and they're fertilized with the husband's sperm, or the partner's sperm, or the donor's sperm.
Okay, and then they're put in
the use. And the problem is that it's very easy for people to be judgmental and to stand out there and say, I would do this and I would do that. No one can put themselves in the place of a desperate and fertile woman who craves to have a child. And I think it's... I think it's basically important to be sensitive to other people and realize that this does help women have babies. It's highly successful in the right setting. Choose the right setting, that's all it means, and the cost is expensive.
Is it less, though, if you're using eggs in the family?
It is less, yes, but if you are...
Now, you all know you wanted to know that question, but is it eggs in the family cost you less?
Yes, but the issue is that the expense is high, and good centers are trying to be responsive to this expense. And in our particular case, for example, because of consistent success rates, we're able to give people 1 year of in vitro treatment for a single fee because we know success rates are good. And I think other programs will be able to follow that, sometimes even 1.5 years for the cost of what maybe 1.5 attempts would cost.